director of the National Institute of Health. I believe it was 2009 when he started there, and then, as you heard, reconfirmed in 2017. The NIH is the world's largest funder of biomedical research around the world. Dr. Collins, you've led those efforts. You also led the efforts with the Human Genome Project. So these amazing, large-scale achievements. But in particular as well, you focus some special effort on SMA. And that's what we thank you for. In addition to all these amazing, broad work that you do on the research side around the world, the focus that you've given to SMA in particular, the SMA project, funding all that early research that found the targets that led to these treatments. Thank you so much for doing that.
Now that Kenneth has told you his resume, he is an MD, but you know what? He's a regular guy. And I want to just bring him up here with a story, which is we have our mutual friend Mike Milken, through whom I met Dr. Collins. And he's a big dude out in the world. And I just decided, what the heck, I'm going to go up and ask him if he'll come speak at our event. And you know what? The minute I said, look, I've got these two boys and that, he obviously knows about SMA. He's testified at Congress about SMA. He's talked to Mike Milken about SMA. But at that moment, he dropped, all that fancy stuff dropped away. He was just a man talking to me, a man to man, father to father, whatever, and just said, I could see it in his eyes that he truly cared. And so we bring to the stadium tonight, let's recognize and celebrate Dr. Francis Collins.
My goodness. Thank you for those wonderfully kind remarks, and for all of you for standing up before I even said anything. That's more than I could have possibly expected. And Walter, it has been a privilege to get to know you a little bit through our mutual friend Mike Milken, and the way in which that creates an environment where people can both talk about amazingly important issues about science and medicine and the economy and business, but also you and I can just be people who care deeply about children, about the future, and that has been a real joy. And thanks to the Zerzans for all you've done to create this environment for something like this evening to happen, and for this momentum to be now so palpable around the tables here this evening, to feel how far we've come in those 9 years since Cure SMA got started. And this is truly, for me, coming to this gathering, an inspiring and energizing moment to be able to see the evidence for that progress. And Kenneth Hobby, you are a remarkable leader in terms of the way in which you have made this kind of organization so vibrant, so full of energy and vision. I actually came down from NIH on the Metro, because you never quite know about the Metro. I decided I didn't want to be late, so I actually ended up quite early and walked in and met immediately Kenneth, who gave me the most amazing tutorial over the course of about 10 or 15 minutes about all of the details about what's happening in SMA that I thought I already knew, but then suddenly realized there was a lot of stuff I didn't know, and this person was able to fill me in incredibly articulate and inspiring ways. So you all are really lucky to have this guy. And then I got to say what a joy it was to be able to hear from no less than 4 members of Congress who you all invited. 2 of them at the cocktail hour and 2 of them here at the dinner. Congressman Fred Upton, Congressman Greg Walden, Congressman Mike Burgess, and Congresswoman Kathy McMorris Rogers, all of whom I count among the real heroes in the US Congress, who have identified medical research as a priority that they would put right up there at the top of the list. Maybe slightly behind defense, but not much, and who have used their influence and the way in which they are respected by their colleagues. And you saw tonight 4 highly respected members of the House to steer the efforts of this country in the direction that leads to this kind of biomedical research breakthrough that we're all here to celebrate. And they are remarkable leaders. And the 21st Century Cures, which was mentioned by all of them, has been a major step forward for medical research, providing stable resources for funding, not just 1 year at a time, but over many years. And I'm glad to hear they're on their way to 2.0, and I will be happy to provide them with advice about what to put in it, which they've already started to ask about. And yes, this is my 11th year as NIH director, and I never quite expected that, but I'm incredibly privileged to be able to stand at the helm of this largest supporter of biomedical research in the world. I already mentioned that I was appointed by President Obama, and to everyone's surprise, including my own, I'm still here. Talk about N=1. I think I might be in that space, but honored to be there. And you know what that says? It says that medical research in this town where everything seems to be contentious is one of the last items that has not become political and not become partisan. May that always be true, because it has that really important role for all of us, for our lives, for our children, for our families, for our friends, our constituents, if you're a member of Congress. This is a moment to make these investments with incredible payoff. I am a physician. My own training was in medical genetics. I was at the University of Michigan in the 1980s. Doing research, trying to find the genetic causes of diseases like cystic fibrosis and Huntington's disease and neurofibromatosis. But I also ran a clinic. And every Friday afternoon, I would go and see patients who were struggling with some information about a genetic disease. And I knew when I saw on the list that I was going to see a family with SMA, that it was going to be a really, really hard conversation. Because in the 1980s, we could diagnose on the basis of the presentation. We didn't have a gene yet, we didn't have a test. But we also knew that this condition, which at that point, the type 1 version was called Wernicke-Hoffman disease, we knew that this was going to be a really tough conversation with the family. And I hoped and dreamed, and maybe even made some sort of a commitment that if I had a chance to play a role in that, that we would have to do better. And that was the 1980s. In 1995, I was at NIH at that point, came in 1993 to lead the Human Genome Project with the hope that that would lead to answers for those thousands of genetic diseases that were still not understood at the DNA level. And I was delighted in 1995 to see spinal muscular atrophy joining the list of those conditions where a DNA diagnosis became possible, although watching it closely at the time, it was kind of confusing. There was this SMN1 gene, and there was this SMN2 gene, the sort of backup gene that had a problem with exon 7. It was like, wait a minute, this is more complicated than we expected it to be. But ultimately, it made wonderful sense. And it provided a therapeutic opportunity that most other rare genetic autosomal recessive diseases don't have. A backup gene that could be activated when the main one isn't working. A lot of other genetic diseases would have hoped for that and did not have it. So there was a promise there, although it was also an opportunity for some confusion and uncertainty about how to approach this. And I watched as my colleagues in the Neurology Institute, NINDS, then made it a priority to see what could be done to identify therapeutic targets for SMA with the SMA project. A lot of effort went into that, a lot of creative people got engaged, a lot of momentum got started. It was pretty clear at that point this was a really hard problem, and I would not say that, looking back on it, that it was necessarily all that successful in terms of the exact outcomes that came from it, but it opened up a vista of opportunity, and it got a lot of people engaged. And it began to look as if this might someday be a condition for which a treatment could succeed. And then we had to depend upon this wonderful ecosystem, which has been referred to by multiple people at this podium, which is this amazing American experience of bringing together the best and brightest in academia, usually funded by NIH, but along with foundations, along with patient advocacy organizations, and with the private sector to figure out how we can take some insights, some ideas, some promise for a therapeutic and actually turn that into a program that might someday work. There is no other country in the world that has that kind of ecosystem the way that we do. And it is amazing to see what has been possible as a result of that. And as people complain about the way in which America's system isn't working, I would encourage them to look at other places that aren't working nearly as well. This is a remarkable area of partnership and productivity. And so, as we all watched with great excitement, seeing gradually the idea that maybe an approach to this that tried to do something to get that backup gene to actually produce normal protein using something that ultimately became Spinraza, or the idea that you might be able to provide a functional copy of the main gene, which has sustained a mutation, using a viral vector, which became Zolgensma. All of those ideas began to emerge. And yet, I'm not sure how many people were really convinced this was going to work, because I got to tell you, when I talk to people in the rare disease community, they would say, I think we're making progress, but you know, the diseases that affect the brain and the spinal cord, they're going to be the last ones. This is really going to be much, much harder. That's just so hard to imagine how you might actually deliver your therapeutic to that space. They're not saying that anymore. And it's because of SMA. It was about 3 years ago that I had occasion to be in Columbus, Ohio. I actually went there on a visit to deal with this terrible opioid crisis that our country is facing. And I'm sorry to say, Ohio has been sort of ground zero for a lot of that. But I knew I was going to be there, and I said, I have got to go by and see what's happening at Nationwide with Jerry Mendel and his colleagues about SMA, because I'm hearing things that sound really exciting. And I had a wonderful afternoon with Jerry, at which point he showed me a few videos of some of his earliest treated patients with type 1 SMA who had been receiving, in a very experimental protocol, only a dozen or so patients at that point, this AAV9 viral vector that was delivering a normal copy of the gene that they lacked. And this seemed so science fiction. And yet, when I saw those videos, I realized I had to accept that something really amazing and dramatic had happened. And one of those videos, I think, is of somebody who was here earlier. Are the Villarreal still here?
She had to step out.
Oh, okay. She'll be back. Well, when she does, we will have to point out, because one of those patients was Evelyn Villarreal, who was here. I saw her at the cocktail hour. Her mom, Elena, her dad, Milan, they live nearby in Centerville, Virginia. And Elena, it tells me that Evelyn is going to be, at the end of next month, 5 years old. And here she is, a young girl who was diagnosed at 8 weeks because they had previously had an affected child. So they knew they were at risk, and therefore got into this protocol very early. When I had the chance to give testimony to the Senate on behalf of NIH about why things are happening that they should want to know about, that are truly exciting advances that justify the $39 billion that the Congress gives us every year for medical research, I invited Elena and Milan to bring their daughter Evelyn to the hearing, which doesn't usually happen. Usually hearings are very formal, you know, everybody sits at the table and tries to answer the questions. Well, it's pretty hard to be formal when you have a 4-year-old who's doing pirouettes in the middle of the hearing room, especially when you realize this is a child who, without this treatment, would probably not have survived past 18 months. And there she was. And there she is tonight, as well as a remarkable example of what is now possible for type 1. And I've learned a lot tonight about the things that are happening with type 2 and type 3, and met some of the individuals who are here tonight who are telling those stories from their own experience. And wonderful to hear those videos from Walter's kids as well. So what a remarkable set of advances. And now we have this opportunity, as we've all heard, about an oral therapy that was based upon very high-tech efforts to figure out if you could screen a library of compounds that sort of represent chemical space, could you find in that library a molecule that had the right properties to encourage that backup gene, that SMN2, to actually make a functional protein by affecting its splicing. I guess I wouldn't have thought that had much chance of working, but there you go. You look at the data from both the basic science study and now from the trial that has led to this decision by FDA to put this forward as a priority review. This looks really exciting, and as an opportunity now for the third intervention. This is dramatic, and this is actually a snapshot of what people had been hoping about for rare diseases, but all happening at once for SMA. People had thought about, we need RNA therapies that will do something about that message that a gene makes, especially if the gene is misspelled. How do you affect the message to make it still work? Well, okay, that's exactly what has happened with Spinraza. People are talking about a DNA approach. If the gene isn't working, how do you supply a gene that is going to work? That's the viral vector, that's Zolgensma. And now people are talking about, well, drug therapies as well, a small molecule that you could take by mouth. That is, in fact, what's now happening with the Roche Genentech effort. All of that in one disease in the space of 3 or 4 years. I would not have imagined in my lifetime that something like this would happen. And so what you are doing here, besides inspiring everybody who cares about SMA, and there are lots of us, you're also inspiring the entire field of rare disease research. When NIH has its Rare Disease Day, which we will have next February 28th, it's always the last day of February, get it? And sometimes it's February 29th, and then it's really Rare Disease Days. But what will be the way in which those diseases that are still waiting for answers will try to see what's going on and try to figure out whether this could work for them? A lot of focus will be on SMA, because you have shown the way. Your scientists, your physicians, you as supporters in Cure SMA, all of the efforts that have gone on in the industry about how this can happen. And rare diseases are individually rare, but they're not collectively rare. I don't know if you know the number. It's about 30 million people in the United States who have a rare disease. 30 million. Now that's made up of thousands of individual conditions that may only affect a few dozen or a few hundred or maybe a few thousand. But collectively, it's a hugely important group that are mostly still waiting for something to happen. And when they see what you all have been able to accomplish here in SMA, they are inspired, they are uplifted, and they're encouraged. And you can see how both academic researchers and industry have gathered together now to see rare disease as an opportunity for advances that maybe wasn't really appreciated a few years ago. So you should feel good about that, both for the disease that you're most invested in and for the whole field of rare disease. I am delighted to see that newborn screening for SMA has come forward. When I was a medical student, I spent a whole summer working on newborn screening. It was for PKU at that point, phenylketonuria, one of those diseases that now everybody takes for granted would get screened, but it wasn't in the 1970s. And this is one of those amazing public health opportunities. If there was ever a case for a disease to be added to that list, now, because we have an intervention that is effective and needs early diagnosis to be maximally effective, it's SMA. So I'm delighted to see 33% of kids now being screened, but darn it ought to be 100%. What's going to happen in the next few months, I'm gratified, but I have to say, because I did a little digging into this with some of my staff help, when Texas isn't going to get around to this till 2021, I got to talk to Michael Burgess about that, who was here earlier. Come on, Texas. You got some resources out there. You can do this. Why do we want to wait when we have the most compelling story until 2021 to make it possible for those newborns who otherwise could be detected now and could be getting into therapeutic opportunities? I'm thinking that we all ought to agree about that. So having said all that and talking as I feel from my heart, what an inspiring evening this is and how much progress has been made. Let me just finish though by saying we are not done here. It's been wonderful this evening having a chance to meet some of the young people who have type 2 and type 3 SMA, and to see those videos, Walter, from your kids, and to see that therapy is starting to provide benefit there as well. But we still have a long way to go to be able to say we have found out everything that we could do in this space. And there's certainly many things that NIH can do in that space to try to continue to make advances in this effort. We have a brain initiative right now that's going to figure out at a very detailed level how circuits in the brain and the spinal cord do what they do. That's going to be really interesting information to fold into this. So I want to tell you, we are your partners. And in every way that we can, using those taxpayers' dollars from all of you, we want to continue this fight until there is an answer for every person who has every form of this condition that really brings them to the full kind of life experience that they deserve. And I'm with you then in the idea that you're both at a point of feeling justifiably inspired and exhilarated by progress, but also that there's more to be done, and that's why your message of hope on the hill seems exactly right. I wear a little button on my lapel. It has a little bit of a story. In 2013, the government went through a very unfortunate circumstance called a shutdown. And for 16 days, as NIH director, I was required to send all of the scientists home under threat if they came back and tried to do scientific research because they weren't allowed to. And I even had to turn away patients who came to the largest research hospital in the world, right up here in Bethesda, the NIH Clinical Center, telling them that we could not admit them because the government was shut down. Let's hope that never happens again. And I felt like, I've got to do something about this. So my wife, Diane, who is wiser than I am, was my advisor about what to do, and I was going to say we should all wear black armbands. I mean, come on here. This is just totally inappropriate for the government to behave this way. And she said, no, we need some kind of a memento of the occasion. Well, I'm a guitar player, and there was going to be something that had to go on the lapel, so I figured, well, let's go buy some guitar picks. So we did. And you go to Michael's and you can find some materials that will turn your pick into a lapel pin because you can glue on these various little bits and pieces. And then you can find a pen that will actually allow you to write on the guitar pick something. So we had to decide what to write. And what seemed most appropriate, even at that sort of difficult moment, was really what NIH is about in the minds of all of us who have the privilege to work there, which is while we're the National Institutes of Health, we're the National Institutes of Hope. That's what we think of ourselves, trying to find hope for the people for whom medical care has not really come up with an answer yet, and they're still waiting, and we want to provide that hope. And so that's what the pin says. It says hope at NIH. That's what we're about. This evening has given me a wonderful opportunity to think about that and to experience that by what has happened here. But it also reminds me of something that somebody shared with me one time about what hope is all about. And it's a quote from a poet named Peter Levi. And think about it, because it seems to really tell the story here. Hope, Peter wrote, in every sphere of life is a privilege that attaches to action. No action, no hope. So when somebody says, well, I hope something happens that will help you, if we're NIH, that means we need to get in the role of carrying out action. That's what Cure SMA has been doing for all of your 9 years and beyond. That hope is not just something that you say as a random conversation and then you move on. You attach that to action. And we still have more action to do. This evening is a great documentation of how far that has taken you. Let's keep going. Let's take it the whole way. Thank you.